Self-harm counseling for schools and prisons. Draft guidelines on how to identify persons who have self-harmed for the first time include school and prison staff in England and Wales. Self-harm is not simply an issue for mental health professionals, according to the experts behind the campaign. According to a mental health organization, the guidelines will provide instructors with the tools they need to better serve students. It sounded the alarm about the dire need for additional school-based mental health support teams. The National Institute for Health and Care Excellence, NICE, is releasing new recommendations on self-harm for the first time in 11 years, and the public may comment on them until March 1st. Although there are various reasons why individuals engage in self-inflicted injury, the most common is because they are struggling with mental health issues or are trying to feel more in control. As many as 1 in 5 17 to 19-year-old females and 1 in 10 boys had self-harmed or attempted suicide, according to a 2017 poll. 7% of girls and over 3% of males between the ages of 11 and 16 are impacted, with those suffering from mental illnesses more likely to have self-harmed. Though few people go to hospitals, and because the issue is generally disguised, experts suggest the numbers might be overestimated. The advice will be broadened to include non-health and social care practitioners as well as those in educational and criminal justice settings. In this case, if someone who isn't a mental health expert sees someone self-harm, they should get a psychosocial assessment done as soon as possible. The assessment should be done by an expert in mental health. When a person has self-harmed, these examinations help determine why and ensure that they get the treatment they need, while also letting loved ones know what is going on with them. How can you tell if someone is self-harming? Prevent wounds and bruises that you didn't anticipate. Anyone who exhibits signs of poor self-esteem or withdrawal should be on high alert. How to prevent harming yourself? Consider venting your emotions to a close friend, member of your family, or a volunteer. Try soothing breathing techniques or other activities that you like in order to alleviate your stress. You don't have to tell someone what's on your mind. Taking a stroll, listening to music, or doing anything else that interests you is a good way to distract yourself from your feelings. Self-harm treatments. Health professionals, such as a doctor or nurse, may advise you on the best course of action, including self-help or support group participation. Adults who self-harm should get cognitive behavioral therapy or a comparable treatment, according to the new recommendations. As per the recommendations, dialectical behavior therapy tailored to the needs of teenagers should be explored for children and young people with major emotional disorders who often self-harm.